for joining us.
Hello, hello,
Yes.
good
Yeah.
evening.
So welcome to another show of Tell Me About It. So I visualize this show especially to spread coaching awareness. What I've seen in my practice is that people hesitate to come in the session. They have this fear that what is going to happen or what will be required to reveal. And so there is a mission through these sessions to actually let people know what actually happens in the session, and that they don't have to reveal or go into areas where they are not willing to. Coaching is a very client centered conversation. Client decides, or the person or the coachee decides where exactly they want to go, what they want to do. So the coach partners with the client in order to bring out their potential, in order to bring out their fears, frustrations on the table, so that we can decide what we can do about it together, what support they need, what resources they need. And today we have Dr. Mitesh Makwana joining us. So I will let Dr. Mitesh Makwana only introduce himself. Welcome, Dr. Mitesh Makwana, to tell me about it. And I'm so grateful that you are here joining us today. Over to you.
Thank you so much. Thank you for having me, first of all. And thank you, myself, Dr. Mitesh, as you said. But I've completed my MBBS from Nair Hospital, Mumbai. I've been currently preparing for my PG right now. I have to complete my MD also. So, yeah.
Okay. So have you done coaching before, Mitesh?
Yeah, I have done coaching before. I've done it
Okay.
once.
All right. So how was the process for you?
Well, the process was quite smooth. Like I had different expectations from it, and it went at a different angle away from my what expectations were. I was
Mm-hmm.
quite anxious about it and quite, initially I didn't know what was going to happen, but
Okay.
the journey went quite smooth and the entire session went quite smooth, and I was quite uh, I didn't know, like I will get such a perspective from my own self.
Okay. All right. So that's wonderful that you're getting the gist of coaching, that you're saying I got a perspective for myself. So I'm very happy to hear that. So today, what are your expectations from the session?
uh, Today's expectations, like currently I have a little bit of ups and downs going on. Like I
Mm-hmm.
said, I'm preparing for my PG exams, my PG entrance exams as well.
Mm-hmm.
So there are a bit of ups and downs, so I need to sort some things out. So that's what my expectations are from today's session.
Okay, amazing. So let's get started with that part. First thing, I am a partner to you. I don't advise. Yes, I would not be sitting there and telling you what to do. Because as a coach, I believe that everything, all the answers are within you. You are an expert in yourself. So, what you want to do and what are your motivations, only you know. Nobody on this universe can make you do something that you don't want to. So your own willingness, your own understanding of yourself is what will lead you towards your potential, right? So in the 40 minutes that we have today, yeah, what is it that you would like to take from the conversation?
Uh, so basically, as I said, that what's happening currently is that facing a little bit of, you know, the situation. What I'm feeling is that I have preparations going on, and a little bit of family issues as well, some health issues as well in the family. So
Mm-hmm.
that has becoming quite overwhelming for me. Like I have to pay attention there as well, to
Okay.
my own parents as well, and to my preparations as well. So, and preparation becomes quite stressful. I don't meet my daily goals. That becomes quite overwhelming sometimes.
Okay. So you're saying that because there is a health situation in the family, you have a kind of your resources are demanded there, as well as your preparation demands your resources. So you're not able to meet your daily goals. Yeah. So can you tell me a little bit more about your daily goals?
So what my preparation demands is a routine of minimum of 9 to 12 hours of study. Like we have a uh, huge portion to cover, like around 19 subjects to cover. So the preparation demands minimum of 10 hours of study, which if I divide my mind to all the family issues and everything, which I don't meet that goal, and that makes me worried about my own future. Then even what my, like, the life is going to be, what expectations I have from myself.
Hmm.
So that entire, like, creates a burden on me sometimes.
Right. So if we have to divide, there is one part of Mitesh that is saying that I have to be there for my family, right? Then there is this another part is constantly asking questions about how do I these 10 hours I've not put in. So how am I going to make it into whatever my goals are? These 10 hours I haven't completed, right? And then a mental conversation starts about your future, right? So out of these three, right now, what would be at the topmost?
Right now, it depends, like, what what I'm starting my day with.
Mm-hmm.
Like as I said, there are health issues, so if I have to be at the hospital and accompany my relative, then the entire day goes with that perspective, with that set of mind. But if I have to be at home and study, then my the entire mindset shifts toward that side. But still I'm unable to focus sometimes over there. So that is that, then at the end of the day, when I don't meet that goal, then it becomes overwhelming, that
Yeah.
what am I doing, I mean.
Yes. What am I doing here? How am I going to finish this thing? Yeah. So tell me a bit about your family situation because that seems to be on the top of your mind. Like you're like, I have to go to the hospital. You said, right? So what is that situation for you? Like you're saying that I have to get up and maybe spend the entire day in the hospital. That must be quite overwhelming for you, right? And that
Yeah.
I feel is very noble of you actually to be available, right? So what is that part? Just take us there a little bit.
So the thing is, that, being a, like, this is what I have in my mind, that, like, being a doctor, certain things about how the entire treatment is going to go and what are the outcomes and everything.
Hmm.
But even if you have reached that phase, you already start overthinking about it, that what if this happens, what if that goes down.
Hmm.
Because for us, for a people who are not connected to that field, they don't know what is going to happen and how this is going to progress.
Hmm.
But me, I probably overthink it sometimes, that what if this progresses in this certain way.
Okay.
So that makes me worried a bit more
Right.
in
So
that field.
there is a sub layer of because you as a doctor you know how the trajectory is going to proceed, right? You kind of start thinking. So it sounds like you are thinking around negative outcomes. Am I reading that right? Like the moment you're starting to think. So have those negative scenarios happened for you so far in
So
terms of the
far,
hospital visits with the
yeah, so
family
far,
situation?
touchwood, whatever I thought, it didn't go that way.
Mm-hmm.
That there were quite positives, which in currently speaking, which I'm quite relieved about it.
Okay. Right. So what does that tell you?
That I sometimes overthink and unnecessary unnecessarily I overthink about it.
Okay. So you say that I am unnecessarily thinking about it. Okay. However, the fact remains that we are thinking around it. And that is the knowledge of you being a very good medical professional. You've studied about it. So that kind of brings it. So, in the future situation, what would you like to do with the knowledge that you have and the fact that you want to be available for your family member? How would you want to use this situation that you've just undergone?
I mean, like, I think that taking it one at a time and processing it and not thinking more about the future would be better.
So what did it add, like when you thought about all these outcomes, when they have not happened, but you started thinking around them? What was happening to you?
Well, as usual, the anxiety kicks in. My focus from my preparation is deviated,
Hmm.
and all sorts of things around it. I just keep on bushing around it. That what if this? What if that?
Right. So how does it serve you now that you know all these impact? How does it serve you to think along those lines?
Like, yeah, like, doesn't go that well, but I feel
You say, tell me, it's okay. Take us through
yeah.
there. This is your time.
I mean,
What is the thought? What is the thought behind all of these negative outcomes?
the thought is
Tell, I'm here, I'm here. And Mitesh, you can say it. You can. Say what you haven't been able to say to yourself.
like that over assessing things is also like it. I know that it is harmful for me. I try to suppress it, but
Mm-hmm.
it somehow it comes out that it just deviates me through everything.
Right. And that is what we are. Now, we are not wanting to suppress it right now. What we are trying to do is we are bringing that vulnerable thought out there. So you are equating there that my presence is there. So, what is a thought? Next thought, like if I am here, what should happen or what should not happen?
Like considering what the situation is.
Hmm. There is a thought that you are putting forward, that I start thinking around negative outcomes, what will happen, and all those things. Right? On hindsight, we are able to see that nothing of that sort of happened and you are relieved. But when you are in that moment, right, what is causing the stress?
Like I know on the back of the mind that I have my preparations as well, and I know that is getting hampered as well.
Mm-hmm.
That at some point of time that also kicks in, that okay, so I have this much, all this has to be done, which I'm not going to do it. Plus this comes, that I have to deal over there with. I have to talk to other doctors as well about opinions and everything, the treatment and stuff and everything.
Mm-hmm.
So everything comes together at some point.
Okay. So there is a lot of demands and all that are being placed that we've
Yeah.
seen. Yes. What is the biggest demand you're placing on yourself?
um, on myself, that I can handle it, that I can be there here and as well I can manage it. But at the
Mm-hmm.
end of the day, when it doesn't happen, that's what makes my confidence go down,
Hmm.
and that's what makes me overwhelmed about all of this stuff.
Hmm. So your confidence goes down when you're not able to put in the 10 hours, because if you're there, you cannot be here, right?
Yes.
Yeah. So what is that confidence? If that confidence were a small child, what would it tell you?
Like me as a small, like a kid,
Yeah,
if
okay. Let's take it that way.
uh,
You're a smart kid.
like, yeah, when I was a kid, my confidence was at a different level. Like, I
Hmm.
was like the best out at my confidence level. So, yeah, if that was the scenario, um, I would have made smarter decisions,
Mm-hmm.
like not investing much of my brains where it is not needed, which
Okay.
I'm doing right now.
All right. So you're saying that you would have taken smarter decisions, right? So what comes to mind as you're saying this right now? See, I'm investing my energies in something that I should not. What is that?
Like over expecting from my own self, like
Mm-hmm.
the expectations which I have from my own self is
Mm-hmm.
what is maybe putting that burden on me.
Hmm.
Sometimes I just over expect my from myself that, yeah, this things are there, then that has to be done in this much of amount of time,
Hmm.
like from preparation perspective. And when when these obstacles come in, like I have to be at the hospital as well,
Hmm.
considering them as obstacles.
Right.
So that's what then entering, that's what then my expectation from myself, or which causes the entire this.
Okay. So name three expectations that right now you are having from yourself. You're saying that I heard the word over expectation. Then you shifted to I have expectations from myself. So if you had to put three expectations on yourself right now, what are they?
Mm, of course, to do well, get the dream branch of my own
Mm-hmm.
from the entrance
Okay.
exam,
Right.
and to build a better future.
Okay. So
Like,
if I, yeah,
no
build better
problem.
future, get a brand, the branch that you want. Third expectation.
Mm, third expectation. Probably to be available for my family, like my own parents, which I'm not available right now.
Hmm. Okay. So just now you told me that you are there, you're going to the hospital for this relative, always being there, consulting doctors. All right. And then you're saying I'm not available to my parents. What is the gap here that I'm seeing?
Like, I expect from myself that I need to spend time with them as well.
Mm-hmm.
Um, Probably they don't expect because they have understood the fact that this is what my life is going to be.
Hmm.
But
Okay.
I have an internal expectation that I need to be there as well.
Hmm. So what happens when you're not being able to meet this expectation?
I do feel disappointed by my own self that some things, a few things, if changed from here and there,
Mm-hmm.
um, can make a smooth flow. But making that those changes are also like becoming, getting difficult for me.
Okay. What would those changes be, Mitesh?
Um, like the same changes, like not expecting much from me, like from the preparation perspective. If I lower down a bit of those expectations and I
Mm-hmm.
can manage time well,
Mm-hmm.
um, then probably I can fit in some time for being
Them
available for my parents as well.
for your parents also. Right. So if right now we have to look at it, okay, you're saying that I want to get in the branch. So what is this particular expectation that I have to put in 10 hours? It is necessary, but what is this expectation doing to you? Like, take me in your day when you are sitting in a day and it is like, let's say, 2 o'clock in the afternoon. What starts happening in your mind if your brain starts assessing that, okay, 10 hours not happening today? What starts happening?
Um, like I just keep on rushing it. Like,
Hmm.
okay, this is what I have done till now. This is what my the coming hours of the day are left. So this is
Mm-hmm.
what I have to do and squeeze in somehow to complete that goal.
Hmm. Okay. So a metaphor is coming to me, but it's a little sexist metaphor. Can I share?
Yeah, yeah,
Okay. Why sexist? I say because I'm going to give a woman's metaphor there. Okay. You've typically
okay,
seen a woman in a kitchen.
yeah.
Okay. If this, we are going to play with these scenarios. Okay. If this woman is in the kitchen, there are a lot of utensils. Okay. Around. She is making at least, let's say, 5 or 6 items. All right. And there are people outside who are constantly asking for food. What is going to be the situation with the woman?
Mm, she is going to be in the rush. Like, okay, this is also has to be done. This is also has to be done, and I have to be
Hmm.
there on time and everything.
Hmm.
She is going to be in rush.
Okay. So before we go further, if realistically you're taking a drone view of this person, okay, what thought comes to your mind?
Like things can be eased out. It's
Mm-hmm.
not necessary that like we like from her perspective, people can understand.
Hmm.
Things
Apart from
can be
that,
eased out.
let's keep the people out. People are asking because they're hungry. They're asking. I'm looking at the woman. You have a chance to say something to this woman. All right. What is it that you're going to tell?
To calm her down that it's okay. You don't need to rush. Uh, you don't need to rush. You got it. You have done it before. You know it how to do it, and you can be there on time and everything.
Hmm. Before that, also, these are solutions that you are sharing. Okay. Before that, also, what is a kind thing we can tell her? What sentences you came up with? Reassurance. They are wonderful. That is the second level of compassion that's coming in. What is the first compassion you will tell the woman? Like she's making chapati, she's cutting something, she's stirring something, 2, 3 utensils are falling down. What is the first thing you would want to tell her?
Do you need a help?
Okay. That is again a solution coming in. Then it is like I am coming to share your problem. Right now we are only wanting to talk to the woman. What is it that we can kind of first thing that to the woman we will like to say? If she says, I'm such a horrible woman, I cannot manage this kitchen, I'm not able to do this. If she's muttering that to herself, what would you want to say to her?
It's okay. You don't need to. uh, overthink on how you are doing. You
Mm-hmm.
just need to carry on how you do it. You got this.
Okay, you got this. All right. If you had to look at her in a kind way when she's saying, okay, what is making her life difficult in that moment?
Expectations from herself.
Expectation from herself. And what are the circumstances?
She has to be she has to be prepared on time.
Okay. On
She
another
has to
day,
provide for the
yeah,
people waiting.
on another day, let's say there are no guests, there are no, how do you say, demands. She just has to cook for herself and her family. What would be different in her kitchen?
Like when these people are not there, and
Hmm.
she would
What
be
would be the
calmer.
calmer, right? All right. So if today she's not calm, okay, what is it the kind thing that she needs to be told? All of that stands that you said, yes, you've got this, you've done this before, you can cook very well. But today, particularly, what is the issue?
Like
Oh,
uh,
yeah,
she has got too much stuff to do for today,
for today.
and she has a lot going on in her head.
Mm-hmm.
So she has to just process it in a certain way because she knows what has to be done. She has to just follow a certain kind of process and
Okay.
just not think much about herself and not expect much about herself.
Okay. So it doesn't reflect on her ability, right? It is just the circumstance right now. Yes. So the kindest thing that you are telling her right now is that it's okay. You know how to do this. It's just circumstances are a little heavy today, right? And after that, the second level of compassion that you brought in. Do you need help? Okay, it's okay. You got this. Now I'm going to take a minute and ask Mitesh why, what connections Mitesh can see in this example and in his life.
Yeah, there are too much things to handle, but just a proper mindset and a because I know what has to be done. Just a proper mindset and a proper process has to be followed. Not thinking unnecessary about other things and not sabotaging my own self confidence.
Okay. So you have a feeling that you're sabotaging your own confidence.
Yeah, kind of.
Tell me more.
Maybe.
Tell me, maybe, kind of. Okay, tell me more. Go in that area. Go there.
Yeah, like sometimes I think that things are not even worth, like, is it even meant for me?
Hmm.
So, yeah, just the thoughts pass by.
Yeah, thoughts pass by. Okay. So when you're looking at this woman and you said all those things, can you repeat that just using with the word Mitesh in the beginning? All that level of compassion that you send that to that woman, if you had to like translate it as a message to yourself, can you just say it?
And
Can you say it right now?
that you have got this, you can do it. You just need to focus on what you have. Like, not even focus, but you know what has to be done.
Mhm.
Just follow it and just go on what is there for you. I mean,
Okay.
and not think much about it. Not think much about what is going to be the outcomes and whatnot.
Mm. Okay. How does it feel like now that you're putting this into table? How does Mitesh inside feel? We were talking about Mitesh as a kid a little while, right? And we saw Mitesh offer compassion to another one very quickly. What is happening to Mitesh when it comes to offering compassion to yourself? What makes you
It's
want to be so hard on yourself?
yeah, like it's just things can go easy, things
Hmm.
can go smooth. It's just my own self expectations and the burden I put on my some of the burden is what I am putting on my own self,
Okay.
which is not even needed.
So if we were to imagine a backpack with you, all right, what would you want to remove so that your backpack is lighter?
Overthinking,
Okay. So we are dropping overthinking, all right?
yeah. First of all, first and foremost, the
Yeah. So
biggest thing
what makes
I
it, yeah,
that is
what makes it difficult like to drop it? If we are dropping it, that means it was there with us till now. What makes it difficult kind of? Why haven't we dropped it so far?
it just I just keep on, you know, it just comes from within. I don't know,
Okay.
like
All right. So if it comes from within, all right, how do you become
yeah,
consciously aware next time so that it doesn't take so much toll on you? What would you like to do?
like engage my mind in something productive enough so that I don't think about it.
Hmm. Okay. So can I share a technique right away? Yeah. Would you be open to like practicing
Yes,
something
yes,
that I share, right? All
yes,
right.
yes.
So I'm going to give you two tools and you see which works with you. All right. So if you are having a box that says now and not now, all right. And let's say you go into a situation and your mind starts thinking, all right, oh my God, I'm going to fail. I'm not going to get into this admission. I will not. I'll be poor. I'll be on the streets, all kinds of worst case scenarios. Okay. If you have to ask them how important they are in the now, and if you get an answer, not important, can you pick them up and put them in a bucket called not now?
Yes,
Is it possible for you to do that? That
yes.
now, okay. Supposing you're standing in the line and you have forgotten a pen, okay, and like you're three this away, all right, and your mind starts thinking, oh my God, I have not carried a pen. Okay. Now, is that something that you'll handle in the now or you'll say not now? You're about to reach on the counter within 5 minutes.
Now,
Now, right? So, can you see the demarcation of a now and a not now? So, when you're thinking of all those worst case scenarios, have they happened in that moment?
yes.
Have they happened? Like all these things that you're starting to think,
No,
have they?
no. Yeah, I have thought about it, but they haven't happened, so
Right. So,
they
if they
can get
haven't
distracted.
happened, can we handle it? If something has not happened, can we handle it?
No,
Right? It's like if I tell you, Mitesh, I'm giving you a cucumber, please cut it. Have I given you the cucumber right now?
yes.
I have given you, have I?
No, I
Can I
mean,
give?
no, no, no.
Yeah. So can you cut it? If I'm not given it to you, can you cut it?
No,
Okay. When can you cut it?
whenever I get it, whenever that cucumber arrives.
Oh, lovely. So now if you have to take this as a situation, all right, when you're
Mm.
thinking that I want to drop overthinking. So the moment a thought comes in, all right, and the thought is of a nature that something negative will happen. Okay. What can you do?
Think about it, that has it happened or is it important right now?
Hmm.
If not, then we
Okay.
clear it out.
Wow. All right. So overthinking, because see, normally people say we should drop overthinking, but there's no how. So the next time we go into the situation, we again start overthinking, and then it starts stressing us out. So rather, if we have a tool ready in the mind that okay, this is what I'm going to do, would it help you? Can you like think of any situation where you can start using this tool?
If I start thinking about my future more now,
Hmm.
rather than focusing on what I have right now, and I
Hmm.
can use it over there.
Right. Okay. So you're already fixing that. Okay. Next time I think about my future, this is what I'm going to do. All right. What is the second thing that you would want to drop? One is overthinking from your bag. What else?
I don't know whether like self expectations and overthinking are considered
Oh,
one thing
it's
or
okay.
they are different.
Who will decide for you, Mitesh? It's you deciding for yourself,
Alright.
right? So self expectation. All right, let's take self expectation for a minute. What are the self expectation that weigh very heavy on you?
Same, the future,
The
like
future.
my own career and everything.
Okay, my own career and what is the line like? If you can shape a line of self expectation and tell me, what would that be?
Like which are the self expectations which are line with what I didn't get that.
As in, right now we are using the word self expectation, right? That
Yeah.
is general. I want to be the president of India. That would become a very specific self expectation. Okay. Or I want to be able to earn 5 lakh rupees per month. That would be a very clear self expectation of a financial nature. So that way I'm asking, how can you make one like a sentence that defines your self expectation, which is heavy for you right now?
I like um, I want to be successful enough that I have a I have a lifestyle which is better than what I'm living right now.
Hmm. Okay. So a better lifestyle. Yeah. Okay. Can we still become a little more specific? Because that is again a future outcome.
Okay.
Let's get more specific.
In current scenarios,
Hmm.
um, like to be available everywhere and manage everything at once.
Okay. Yeah, that is a self expectation that I should be available everywhere. Okay. What is in that expectation that overwhelms?
Unable to meet that expectation.
Hmm. What makes it unable to meet?
Some that it might not be possible. You like
Okay. So, if can I ask a little bit of how do you say straight question here? Okay. So, in our mythology, we had our gods, being available here, there. They had the superpower to transport themselves. Okay. Do we humans have the superpower? Or do we have a
yes,
possibility of, creating a Xerox so that you can be here also, and given somewhere else also? What is the truth about
it's not
human being?
humanly possible.
Correct. The moment you say this now, what happens to you?
that I can be easy on myself a little.
Mm-hmm. You can be easy on yourself. Okay. What would happen if you're easy on yourself, Mitesh?
That unnecessary burden which I feel won't be there.
Mm-hmm. Hmm. Won't be there. So now you know this, and back with the fact that there is no superpower available to us. What would you want to do with this expectation? Next time it visits you, hello, Mr. Mitesh, I want you to be the Superman. What would you want to do?
Like if what my expectations would be possible. So like that.
Yeah, like you're a doctor, so let me lead with a small example. Okay, you've been in a general ward, right? You have been on a general ward, all right? Let's say a small emergency happens, and there are six patients, and all six are lying in the bed. Okay, can you attend to all six of them together? You are the only doctor there,
Not
all
possible.
right? Not possible. So, what would be the best practice in that moment? As a doctor, what would be your best method?
To attend to that one patient which requires the most attention, like to
Hmm.
divide them into severe, not so
Huh.
severe, emergency.
Right. So you will go to one bed, examine them. If you are while examining them, you're looking at the other bed. What would happen? Let's say you have an
Like if
injection in
I
hand, and if you're with this patient, and you keep looking at that other fellow who's crying and shouting in pain, what would happen?
I would want to attend that person as well, because
Hmm. But what would happen to the patient at hand?
uh, that procedure won't go well because my there is no full attention to it.
Correct. So would you be serving both the patients then in that case?
No.
So again, coming back to this, all right. As a doctor, what would be your priority in that moment?
Attend one patient at a time
With full focus.
with full focus.
Amazing. Bring that metaphor again to your life right now, Mitesh. You talked about self expectation. I want to be available everywhere. I want to be able to do everything. What would you want to now to do?
Deal one thing at a time, irrespective of whatever happens, but that can be dealt if I complete one thing and move to the next one,
Hmm. And that way, what would
taking
happen
one
to
thing
your
at a time.
energy? Yeah. What would happen to your energy if you do that?
It will be evenly divided.
Mhm. And then when you're sitting with yourself at 2 o'clock, how would you think about yourself?
A more composed way that I have everything planned and everything dealt with it properly.
Hmm. Okay.
Dealing with one thing at a time will, like, there will be a proper process and a plan to it.
Okay. So let me take you back to the metaphor of the six patients. All right. You attended to all the six patients with complete focus, giving them proper treatment, attention, focus. Out of them, two died. Okay, because by the time they entered the hospital, their injuries were really very grievous. All right, you. What is the thing? What is the sentence that you say? It's unfortunate, yes, but as a doctor, okay, what would you say?
To myself.
Yeah, because you've treated them full night. You gave them injection. You probably treated them, whatever you monitored them, everything. But out of the four were safe, two died.
Well, I would assess it that what what could have what was in my hand that I could have done
Hmm. That is
and
reflection.
what didn't happen.
Yeah, that is
Yeah.
reflection. But at the end of the time, when you're sitting? What is the sentence that comes to mind?
That these are the part and parcel of my job.
Hmm.
This is the part and parcel of my job.
Right.
Things are going to go which way.
Correct. I did my best.
Yeah.
What stops you from saying that to yourself, Mitesh, at 2 o'clock in the night?
That things are going to go up and down, but
Mm-hmm.
I just need to focus one at a time, one thing at a time.
Okay.
Like these are like, you know, part and parcel. Like as that was a part and parcel of my job. This is a part and parcel of life. Things are going to go up and down.
And when they go up and down, what can make your journey easy?
Like not uh, thinking much about how what are the outcomes going to be.
Mm-hmm.
Just dealing with the proper process
So, what does Mitesh essentially need in this moment from Mitesh?
from my own self.
Your own self. And where is your own self gone? Where is he?
And not getting lost in all of this burden, just putting it like understand, not as the same thing goes, that not expecting much from yourself and thinking that okay, this is how it, if it has happened, this is how it has to be, and focusing one thing at a time.
Okay. All right. So, that is the learning that you're saying from the session you had today. Right. How are you feeling? Like in the beginning, you were like, I have these so many goals, 10 hours not being available. Where are you right now?
Like I do understand that what more I was thinking, and like what I was expecting from myself. I didn't think
Mhm.
about what were my expectations before from my own self. But now I think, and what can be avoided, and what has to be, what are the main expectations should be from myself. That the only thing should be that I need to focus one thing at a time rather than expecting much about the future and everything.
Okay. So, if now what is there in our backpack? We've dropped overthinking, we are adjusting the self expectations. What would we like to carry in our backpack?
Self confidence.
Hmm. Okay. Self confidence. What else? We've emptied the backpack, no? So, we need new things in it. So, what would they be? What is getting in the way of self confidence then?
like um, my own expectations from my own self were what I guess were suppressing my self confidence,
Mm.
which I knew I had it in me, but I wasn't able to express it before.
So now that you express them today, what has shifted for you?
Perspective that you know that I have it in me,
Mm-hmm.
but unnecessary. I don't need to just expect from myself that I can do that as well. I can do that as well.
Okay.
I can just keep things on hold at a moment and just uh, bring it in a certain way.
Okay. Looks like you're really having a lot of thoughts around that. That okay, this I can put aside, this I can arrange like this. Okay. So do you want to put anything in the backpack or you would want to give it some thought? Right now you're happy dropping it. Do you want to collect something before we close the session?
Um, well, I would go with just a empty backpack rather than keeping a negative
Anything.
burden to it
Okay.
and
All
add
right.
success to that backpack.
Success. All right. Self confidence and success, two things we have.
Yeah.
And how will we collect that success? We've dropped overthinking, we have dropped expectations as of now. Success, self confidence, they are worthy goals. What else would you like in your backpack? Not to think, yes?
Yes.
Ah, okay. All right. So,
Okay.
what is what's,
I
yeah,
can
tell
put
me.
my
You
like I
can put
can put uh, the thoughts which will just put me forward rather than put me behind.
Hmm.
Self positive affirmation, I'd say.
Okay. So, what is one self positive affirmation you want to design right away if you're given that superpower? You said, I'll bring forwards. Design one for yourself right away.
Like I know what has to be done
Mm-hmm.
and how it has to be done.
Mm-hmm.
But if I just keep a right set mindset and clearing all the obstacles or the expectations from myself, there
Mm-hmm.
is nothing can stop me.
Okay. So, can we stay with that? Nothing can stop me.
Yeah.
Ah, okay. That's powerful. So, taking us a few seconds, would you like to kind of summarize for me what are you taking away from the session? How was it for you?
Um, well, yeah, I just now understand that like the entire fogging of thoughts which had happened with me, like I was fogged with all the things, the expectations, and the self burden and everything. Now I can see the road ahead clear now.
Okay. So, it's like all the utensils have been cleaned and kept away in the kitchen. Yes.
Yes.
And our backpack is full of success and self confidence.
Yes.
And the tool is basically with Metesh, that if I have that confidence, nothing can stop me. And I put the debris away of thoughts, then nothing can stop me. So what is one small step you're going to take? Actual action step you're going to take as soon as you kind of finish this session.
Um, like after this such what will be my um I'll 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 write this sentence on a piece of paper and stick it on my
Okay.
cupboard to
All
make
right.
me remember that I don't that is what that is what affirmation I have, and
Okay.
also uh, plan my uh, time ahead
Mm-hmm.
at what has to be done now.
Okay. And while planning, what is it that you're going to kind of remember?
That I don't need to expect much from my own self. I can be easy on myself.
Can be easy on yourself. All right. So, is there something else you want to say before we close the session to feel complete? Any support you need?
uh, yes, I'm quite much relieved right now, actually.
Mm-hmm.
With with as I said, I was quite fogged up, and I had a lot of you know uncertainties, that what I don't know what am I doing and everything. But now I'm quite clear. Like, okay, things can go easy, and that that depends on me only.
Mm. Okay. Wow. Right. So, what would you like to say to people now about coaching? Now that you've had this entire experience, share something.
Okay. Yeah. Co- this was my actually second session I had, and it always like actually brings my own perspective out. Actually, coaching is something which I would say it is bit different. Like it's not a huge deal. It's just a conversation actually you're having, and sometimes actually it also after the session you quite feel silly as well. That okay, I knew what had to be done, but just I didn't think from that perspective. So the metaphors and everything, it quite really helps. That okay, this can be applied to us as well.
Yeah, all right. So thank you so much for being there, Mitesh, and very vulnerably putting yourself out there. It's not an easy thing to publicly go and share all of this. Yeah? It feels very heavy and difficult, but you showed that courage. And I'm hoping that in hearing your story, your session, someone else also finds the same solace that we found today. Is there anything I can do to support you? Is there any support that I can share from my end before we close?
Um, well, can I, like, if needed, can I have another session as well?
Sure, sure, absolutely. You're always welcome, Mitesh. Yeah. So can we close?
Yes. Thank you so much. Thank you so much for
Good.
having
Good
me. And
luck. Yeah. Good luck for
please,
your exams. You'll crack it, and
thank you so
may
much.
confidence, success, everything walk with you in your backpack always.
Thank you. Thank you so much.
Bye.
Bye bye.